the leaders of the countries need to understand the burden that TB poses on their population, on their economies, which of course is uneven. You know, you have countries that are having a bigger burden, countries that don't have such a big burden. So it's not such a big, you know, it should not be everywhere in the same way. But the countries that have a high burden of TB, where their population is dying because of TB, where their economies are heavily impacted because people with TB don't go to work, there is transmission in the workplace, and so on. That's the first point that needs to be understood for the money to come. What we try to push as Stop TB Partnership, which is called the Reimagining TB Care, basically bringing the care, the diagnosis and treatment closer to the people's door, is much better than having all these specialized centers that will request people to commute and to go and to be. So the closer you come to the people and the closer you engage the community, showed in COVID how important it is. And I think we should be smart enough to build on this and use this as well for TB. On UNHLM, there are three things that we want to secure. One is we want to secure working with our partners, especially WHO, which is you know, very much the leading on ensuring that this meeting goes ahead as planned, is to secure the two co-facilitators of the meeting and start the process of consultation with around priorities and you know, content. The second piece is civil society and communities. We want to make sure that they are fully supported in getting organized, in having the right voice, but also, and that's why we are Stop TB planning to support this entire process for civil society and communities. And also the other piece is, you see, we have targets that need to be achieved by the end of 2022. And we have a series of different reports to look at these targets and to see, okay, how well or bad did we do? And one of them will be the one of civil society. A first version called Deadly Divide was produced in 2020. It has a very a title that says it all, the Deadly Divide between the promises and achievements, between the big North and the big South, between the public sector and civil societies. So we plan to support the civil society and partners to develop another Deadly Divide version, but also to discuss with the countries and the member states on the targets that were supposed to be achieved, which very likely because of COVID will not be achieved